Unmute. As habari zenu?
Nzuri.
Hey, I see we are very few today. Which can I get a sense of which classes are present? I know Med 5, I've had Angela.
Yes, Med 5.
MLS4.
Yeah,
MLS4 are present.
MLS 4 are present.
Dental 5.
Dental 5 are present.
BDS 4.
Huh?
Dental year 4.
Dental 4 are present. So 5 and 4.
Physio 3 present.
Physio 3.
Physio 3 present. So who are absent then? Because we seem to be only half of what they, no, even 1/3 only.
I think Med 4.
Med 4 junior.
Junior. Okay, they're present. Med 4 seniors have an exam tomorrow, so they've requested to be excused for this class.
So when will they ever catch up, or you will?
Some of them are here, some of them are feeling the pressure.
Yeah. Because students are not allowed to have pressure. They're supposed to relax and read. Now, so I don't know, there seems to be more absent than present. I suppose we will just continue.
Yes, the number is increasing.
Yeah. But now I want to know something. It is not good for us to use your bundles for half an hour doing nothing. Is it okay if we agree that next week we shall start precisely at 5:05?
Yes.
Haya, MLS, iko sawa kwenu?
Yes.
Iko sawa.
Iko sawa, eh? Dental 5 and 4, iko sawa?
MPY
Yeah?
and the medical psychology.
Medical psychology, iko sawa?
Yes.
I want us, so that we avoid using or wasting bundles, which you don't have, I want us to agree on the precise time we start, isn't it? So I take it, but that democratically as a class, I will start precisely at 5:05, so that we limit the wastage on bundles. Are we okay?
Yes, Doctor.
Yes, you're okay.
Yero kamano. Good. So last week we covered quite a number of ideas, and we shall continue this week so that we see how far we can go and see if we don't finish the health economics component today, we finish next week, and perhaps even start financing, so that by the first Wednesday of April, we finish this segment so that my other colleagues can take on the other segments. And we have agreed it will be on the same arrangements, all right?
Yes.
Yes.
Good. So last week we looked at quite a number of things, and I think we ended at a point where we had discussed many of the concepts that economists deal with. I suppose we had discussed consumption, we had discussed production, and now we want to go further into the things you have been hearing. Now we'll start with discussing demand. Demand in economics. And that would be, for those of you who have the lecture summary, it will be around maybe slide 19 or thereabouts, but I'm not following the summary. I'm just discussing, because that summary will help you. So what do we then mean by demand? And in very simple terms, demand means the ability for a person to consume goods and services, or that act of consuming goods and services to satisfy needs and wants. And so this, just the fact that you want to use or to consume something doesn't constitute demand. Demand is only achieved when you are able and willing to sacrifice resources in exchange for the goods and services you want to consume. So we say that you must be willing and able to sacrifice resources so that you can get the goods and services you want. So in exchange for the goods and services you want. And so therefore we modify our idea further and say the quantity demanded is a function of the price of the good. We have said you must be able and having resources and willing to use those resources. When you use those resources, we call that the price. So the quantity demanded, or how much you will demand, will depend on a number of things. First, the price of the goods or services. Or we can use the singular, the price of the good or service. So the price is very important. That is the amount of resources required. And then you see, a good or service you consume has a related good or service. For instance, a loaf of bread, what would be its related good? What would be its relation, relative? So you can eat bread, and what else can you eat? You can eat biscuits, isn't it? It's the same composition as bread. You can also eat cake, isn't it? So the price, if you are demanding bread, the amount of bread you will demand will also depend on its price, but it will also depend on the price of cakes or the price of other related goods. Because if the price of bread is too high, what do? So you go to the price of the cake. You demand the cake instead of the bread. So that affects the amount, the quantity you can demand of bread. The income. What is your income? What income do you have? What income do you have which is available for you to spend? Okay, so your income decides how much demand you can make, what the quantity of goods and services you can demand. The other aspect is organizational or institutional structure of society. You see, you will demand, the amount of anything you will demand will depend on whether society requires it. For instance, a lot of you people cannot survive without ugali. Yeah. So because of your societal, the structure and institutions of society that require that you haven't eaten, if you haven't eaten ugali, so that will affect the quantity of unga you will demand. okay? And then your tastes and preferences. Your tastes and preferences. Some of you like sweet things, others like pili-pili type things. So your tastes and preferences will also determine how much of goods or services you will demand, okay? This actually represents your socioeconomic and cultural factors, you know. Those will affect the amount or the quantity you will demand of any good or service. Now, usually we say that the most important component of the things we have just said is price. Yeah, price is very important. Price and income. Those are very important. We call them determinants of the quantity of goods and services which will be demanded. Now, so therefore, there is a relationship between demand and price. And that is usually shown as a curve. We call it a demand curve. And this demand curve is the way that we try to illustrate how much would be demanded at any given price. So how much will be demanded at any given price is usually what we illustrate using a demand curve. And for those of you who have the lecture summary, our demand curve is on slide 20. You can look at it, it is on slide 20. And generally, for most goods, more will be bought as the price falls. So if the price falls, you buy more. Okay, so that the demand curve then will slope downwards. You know, the less the price, the higher the demand. And that is represented by the curve sloping downwards. But we assume that all other factors remain constant. Okay, so all other factors remain constant. Now, there is then the next concept about demand, which is the concept of elasticity of demand. Elasticity of demand. Now, elasticity is responsiveness. Other variables. Responsiveness of demand to other variables. So you have this responsiveness will usually indicate or will dictate the shape of the demand curve. So for example, you have price elasticity of demand. Price elasticity of demand, meaning what is the responsiveness of demand to price? Okay. And this one, it's going to be a little complicated, but not too much. So because it is responsiveness, you express it as a percentage change in quantity demanded, a percentage change in quantity demanded as a proportion of the percentage change in price. So let's see if we can sing together. A percentage change in quantity demanded as a proportion of the percentage change in price. In other words, how responsive is the change in price in what you demand? Okay, so if you change the price of something, let's say by a shilling, we have been crying lately when the price of fuel was raised from about 130 per liter to 135 per liter. Supposing when it was 130, you are using 5 liters. How many liters will you use when it goes to 135? Okay, so that we can see that change of 5 shillings, how much change in what you demand will it bring? So if the percentage change in quantity demanded is greater than the percentage change in price, that is, if what results is greater than the percentage change in price, so that, for example, if the change in price is say 10%, but the percentage change in demand is 11%, for example, then that it is greater than 1. So it is greater than the price. Then the demand is the demand for this thing is said to be elastic. So elastic is if the percentage change in quantity demanded is greater than the percentage change in price, then the demand is said to be elastic. So you say ED is greater than 1 is the mathematical formulation. So you say ED is greater than 1, therefore the demand is elastic. If the percentage change in quantity demanded, if the percentage change in quantity demanded is less than the percentage change in price, that is, so that ED, as elasticity, is less than 1, then you say the demand is inelastic. You say the demand is inelastic, meaning price changes influence demand less. Now let us pause here because I know now you are almost falling asleep. And then I want you to tell me which goods do you think are price elastic? What are some of the goods that you think are price elastic? Volunteer from psychology?
I think I'm still wrapping my head around understanding the elasticity of demand.
Higher. Volunteer from, is it physiotherapy? Haya, Med 5, jaribuni. What goods do you think are very elastic, very price elastic?
med psychology,
Yeah.
goods that are elastic,
Yeah.
elastic in demand. I would say
Price
something like
Uh-huh.
bread.
Yes. Uh-huh. Why do you think bread is very elastic?
Yes, there's an increase in the price. Initially, it was 50, now it's 55. But still, you see the consumption is still high. People are still buying it.
People are still buying it. Uh-huh.
So in terms of the demand is still high, yet the price the demand is still exceeding the percentage change in price.
So in the case of bread,
yes,
yeah, the change of price, isn't it?
Yes.
Does not, I mean, we will affect your demand very seriously. You see, if they raise the price of, if they raise the price of bread,
yes,
yeah, you will get an immediate response by demand, isn't it? Yes. Because you see, for bread, yeah, first of all, there are other things you can eat instead of bread. Yeah. Secondly, as we say, there are relative goods that you can consume instead of bread. And then what about the opposite? Which goods do you think have very poor price elasticity of demand?
Petrol.
Petrol is very elastic. You see the scream, eh? When they add. Say, for example, salt. Are we getting the concept now? Yeah. Salt, for those who really need salt, it doesn't matter how high you make it, people will still buy almost the same quantity, isn't it? Notwithstanding the change in price. Good. Are we almost getting there?
What about electronic machines?
Electronic machine, what do you think? You tell me. Because, yeah, what happens if electronic machines are made very high? What happens? A change in price of electronic machines. Would it be elastic or inelastic?
Inelastic.
Would it be inelastic?
Elastic.
Yes, it is. It is elastic, isn't it?
Yes.
Because you see, first of all, you will not die if you don't have the
electronic.
If you don't buy that electronic machine, yeah. But for some goods, yeah.
What can you say of iPhone users? Because when you look at the iPhone category, they seem to always buy these phones, besides the fact that it is, you can use that money to buy land.
Yes, but now you see, the iPhone is an interesting thing. Actually, the iPhone is what we call an abnormal good. Do you know why? People seem to be proud of paying a lot for the iPhone than it is actually worth. Yeah. So these are called luxury goods. Because for you, you think that having an iPhone 12 for 300,000, yeah, is prestigious, isn't it? But that iPhone 12 really isn't any different from the poor phone that you and I use. Yeah? But for prestige, you are willing to pay a lot of money so that you can show. So that my friend from psychology, akiparade your iPhone 12, nani kama yeye. So that is called an abnormal good. That one disobeys the law of demand. because usually the law of demand is the higher the price, the lower the demand. But for these prestige goods, the higher the price, the greater the demand, because it is for prestige, okay? But now, have we now understood, at least general, because you'll still need to read a little more, but are we now understanding the concept of elasticity? That is the responsiveness of changes in price on demand. That is called price elasticity of demand. Okay? Now, if supposing the percentage change, if suppose it evokes a similar change in percentage change of quantity demanded, that is, if the percentage change in quantity demanded is equal, what do you call that one?
Unitary elastic.
Unitary, that's good. It means that is unitary elastic. Okay, because then at that time, percentage change of quantity demanded is equal to the percentage change in price. Okay, now, what affects this elasticity business? What affects this elasticity? Okay, elasticity will be affected by the ease with which goods can be substituted for one another. That is a very big thing, determinant, that affects the elasticity of the price elasticity of demand. The ease with which you can substitute. Like, for example, there is not a big deal in substituting bread with cake, isn't it? Hello?
Hello. Yes.
Yeah. You see, there is no problem, isn't it?
Yes.
Yeah. So you can easily substitute bread with cake. Because of that, that affects or that determines price elasticity of demand. The ease with which you can substitute what you want with another thing in the market. Then you have also income. You have what we call income elasticity of demand. See, you look at the price elasticity of demand. Now you also have income elasticity of demand. Okay, and which measures the responsiveness in quantity demanded, which arises from changes in income. Okay, so the percentage change in quantity demanded as a percentage over or as a proportion or divided by a percentage change in income. So there are some of you who, when you get income, sasa you get income, now you can demand things that you didn't demand when you didn't have income. So I'm told that, for example, kamwewe sasa, when you didn't have income, you would go for githeri, which I love. Is it 50 bob a sahani or 30 bob a sahani? Yeah. But when you get income, you go for the same githeri, but now you call it githeri special. Yeah. Because now your income has increased. Now, sometimes you can even go for the same githeri, but in greater quantities. Maybe when you didn't have a lot of income, like all of you are about to be broke now that you have been in school for long, maybe you are eating half a plate of githeri because hauna nini? Income. But you get a little more income, you eat a full plate. Okay? So that is called elasticity or income elasticity of demand. And you use the same formula as we used in the price elasticity of demand. This one is income. So change of income elicits change in quantity demanded. Okay? Now, then you have a concept called cross elasticity. Okay? Cross elasticity of demand measures the responsiveness in quantity demanded of good A, okay? And so let's say now you have many goods that you can demand in a market. So we'll call one good A. And this arises from changes in prices of other goods. So we were saying, for example, for cross elasticity, you see the percentage change that will be elicited in the quantity demanded of good A, let's say bread, by a percentage change in the prices of other goods and services or other related goods. Okay? This time now, you are looking at the effect that your demand for good A, let's say bread, will be affected by changes in prices of related goods such as cake. So if the price of cake goes significantly down, okay, it might persuade you to demand less bread. You might be attracted to eat cake instead. But supposing cake goes up, then it might force you, although perhaps you used to eat one loaf of bread and one cake, so maybe you eat one loaf of bread or one and a quarter loaf of bread, and you drop the cake. That is cross elasticity. That is, the prices of these different goods, changes in the prices of these different goods affect the goods that can substitute them. And that is called cross elasticity. Okay? So that you say, you calculate percentage change in quantity demanded of good A over percentage change in price of other goods and services, or even to simply say good B. Okay? Right. Any queries so far? I know it is a little heavy today, but you are tough guys, so you'll manage.
Question.
Hey.
I noticed that when you use cross elasticity of demand, you talk of finished products. Is there a relation between, say, for example, wheat and bread? The price of wheat affects the price of bread, or is it
Yes.
elasticity refers only to finished products?
No, it can even work that way. You see, then it will be wheat, yeah? Mm-hmm. The percentage change in the price of wheat, okay, is likely to will elicit a response in the price of bread, isn't it?
Yes.
If the price of wheat changes, it's likely to affect also the price of bread, isn't it? Yeah, that is the cross elasticity.
Okay.
Hero.
Thank you.
Any other query? Now, you see, the idea of cross elasticity is that it measures the association, the degree of association amongst goods. What is the degree of association, say, between wheat and bread? What is the degree of association between wheat, bread, cake? What is the degree of association between wheat, rice, bread? What is the degree of association between, say, petrol, diesel, and so on? Are we together?
Yes.
Yeah. And this brings you the concept, when you read further, the concept of substitute or complementary goods. Substitute or complementary goods. Right? So what have we said so far? One, we have said that there is a concept we call demand, which is our willingness to sacrifice resources in order for us to consume goods and services to satisfy our wants and our needs. We have said that this demand can be measured. We have said that this demand can be measured, and we have said that we can have a measure of price. We can measure with price, we can measure with income, and we have said that the way we measure is to look at the elasticity, the responsiveness of demand to changes in those various, in the various in rise of income or changes in price. We have also said that other things that affect demand are, apart from price and income, we also have substitute goods, we have or related goods, and we also have our tastes and preferences, our cultures, yeah, and then we have societal or institutional structures. Those will affect the things you demand and the quantity you will demand of those things. Okay? Any queries so far? Any queries so far? I know it was a little heavy, but you are tough people, so don't worry. Okay, so we can then move away from demand and go to the opposite concept. And what is this opposite concept?
Supply.
Yes, supply, isn't it? So actually supply is almost, the reverse. Okay. Now, in the instance of supply, supply is the willingness, the willingness of producers to avail their goods for consumption in the market. I'm using very simple terminology so that you don't get confused. So the willingness of producers to avail their products or their goods and services for consumption in the market, isn't it? So that is the supply. The other one, it was demand. That is the people who want to consume those goods and services. Here now we are talking about the people who produce those goods and services. Okay, so then you will say the quantity of a good that producers offer for consumption is seen as determined by certain economic variables, just like demand. Yeah, how much they are willing to supply will be determined by various economic variables. And one of these variables is price. You remember price also determined the amount of demand, isn't it? Price also determines the amount that producers or suppliers are willing to supply. So the price at which a good can be offered is a very important indicator, right? So now, the supply then relates to the quantity supplied to the variables likely to affect it. So we have the same, that the quantity supplied is some function of the price of the good, just like demand. So the price of the good. Now, relative prices, that is prices of relative goods which are available. Cost. Now, you remember in demand we didn't have cost, but now cost. The cost of producing the goods and services, and then you have relative costs. So you have costs, and then you have relative cost. That is the cost of producing similar or substitute goods. And tastes and preferences, which will, just like in the case of demand, include socio-cultural factors. So are we together?
Yes.
So are we together? So it is just like demand, only that this time you're saying the quantity supplied is a function of the price of the good. That is what you are supplying. The relative prices or prices of related goods. The cost of producing that good. The cost of producing related goods. The tastes, okay, tastes and preferences of the people that are going to be, that are supplying. For example, some people will never supply you pork, whatever price you offer, isn't it? So tastes and sociocultural factors. Good. And this is represented as a supply curve. I can't remember what slide it is, but it is somewhere for those of you who have read. You'll see the supply curve. It behaves opposite to the demand curve. And this supply curve will show you the relationship between price and the quantity supplied. Okay? And usually the curve will slope upwards, indicating that more will be supplied if prices rise. So the general rule to remember is that more is supplied as prices rise. So the higher the price, the greater the supply. What happened with the demand? Just so that you don't confuse, what did we say happens with the demand?
It falls.
Yeah, so in demand, it is the opposite, isn't it? The higher the price, the lower the demand. But for supply, it is the opposite. The higher the price, the lower, the higher the price, the higher the supply, or the greater the supply. Okay. So just as in the case of demand, we also have elasticity of supply. Okay, we have also elasticity of supply. And the elasticity of supply is roughly measured or usually measured by expressing it as percentage change in quantity supplied as a proportion of the percentage change in price. So just like in demand. And it will usually give you the same concepts that we discussed in respect of demand. Okay, so it's percentage change in quantity supplied. Sometimes we represent it as SQ over percentage change in price, which now becomes a price elasticity of supply. Okay, so the supply is elastic, where elasticity of supply is greater than 1, just like the other one, the same song. So some goods respond better or more emphatically to changes in prices than other goods, even in the case of supply. And so you have the usual greater than 1, equal, and less than 1. It's the same song, but now in reverse. And just as in the case of demand, elasticity or elasticity of supply will depend upon the ease with which quantities of goods and services can be produced, the ease of producing. How easy is it to produce the goods or services? Yeah, if it is very costly, then that will affect. If it is, if the cost of producing other goods and services is very high, that will also affect the supply that producers will be willing to let their goods and services, be supplied. Any queries so far? We have a query, or are you asleep?
Yeah, we did that.
Yeah?
We are awake.
Oh, good. Don't be asleep, because these are important things, and I will give you an assignment soon. Yeah? Now, when you will be reading, you will find a concept of the price mechanism. A concept of the price mechanism. The price mechanism is really the study or appreciation of how price mediates the interplay between demand and supply. The best way to remember how demand and supply will relate to each other is to say that no producer or nobody will produce goods which will not be consumed. So the producer is the supplier. The consumer is the demander, if there is any such English word. Okay? So where those two things meet through the medium of price. Through the medium of price. And price is the total amount of resources we are willing to sacrifice in order to consume if we are consumers, so that to demand, or to supply if we are producers. What really dictates how much we will supply or demand depends on the price. At any given price, suppliers are willing to supply and consumers are willing to consume or to demand. So that is called in economics the price mechanism. Now, when price and demand meet, and when supply and demand meet through the process, this process is called a market. Soko tu kama ile ya Eldoret West. That is where demand and supply meet and they interact. And of course, they interact through the medium of price, isn't it? When demand and supply meet and interact, they push each other. You see, suppliers want to make more money, so they want to raise the price, and if the price can rise, they supply more. Consumers want to suppress price, so they demand more when the price is low, and they demand less when the price is high. So this push and pull sometimes results in a situation where now they are equal. They are equal. So they come to a state of rest. If they come to a state of rest, that is called the equilibrium. I told you we are learning new language, yeah? So now you know equilibrium. Equilibrium is a state of rest where supply and demand are equal. They're equal to each other. So you get an equilibrium. Okay? Now, this equilibrium, as we have said, is achieved when supply equals supply, and supply equals demand. So that at that price where supply equals demand, you get an equilibrium price. Okay? So the buyers and sellers are content to exchange a given quantity at a given price. That is the equilibrium price. Any queries? You have any queries now?
A question.
Hero.
I'm wondering, when you mentioned the elasticity of supply, are there examples? Because look at, for example, petroleum, the crude oil, when the prices go down, the suppliers tend to hold it a bit. But now look at, I'm looking at something like electricity in our country, for example. No matter how low the prices go or how high, they are still up to be the supply by the Kenya Power. Is that a case of inelastic supply, or it's just, as you say, the aspect of abnormal?
No, you see, there are other things that come into play. The price, the supply of petroleum. You can see the suppliers always want to push the price higher, isn't it?
Yes.
And the consumers want to push it down, isn't it? You saw the battle in Parliament.
Yes.
Isn't it? Now, what happens is that some producers are what we call monopolies. Like your example of the Kenya Power. That is a monopoly. Hakuna competition. In a minute, we are going to be talking about the market, yeah, and the concepts of competition and so on.
Okay.
Yeah. So where there is no competition, that one is called a monopoly. Okay. That is called a monopoly. So in monopolistic tendencies, they affect our concept of the relationship between or the elasticities that we have talked about. Yeah, because monopolies will produce and they will charge whatever price because you don't have a choice. In the same case, if there is a monopoly consumer, a consumer who is alone, yeah, they will tell the supplier, shauri yako, usiponipatia na hii price, mimi sichukui. So you see, you can see now, those are monopolistic tendencies, which we shall discuss in a bit.
Okay.
Now,
could you provide an example of elastic supply and inelastic supply, if there is any?
Elastic supply and inelastic supply. Here now, you see, because the elasticity is responsive, the percentage change in response, isn't it? Yes. So there are, for example, salt, isn't it? Salt is a very good example. Even if you supplied any number of tons of salt, people will still eat the same amount of salt. They'll still, you know, as a supplier, you have very little influence. And even if you lower the price, even if you lower the price as a supplier, people will still eat almost the same amount of salt. Yeah. So it is inelastic.
Okay. Thank you.
Good. Any other queries? Okay. Now, what has all this to do with healthcare? Or what has all this to do with Dr. Angela and Dr. who else and a lab engineer so and so? Yeah. What's the use? Why should we learn about demand and supply and elasticity and price mechanism? Yeah. Why? What is the use of it?
I think it's related to, we usually have procurement processes at the hospital, and everything is about purchasing and selling at the hospital so that you can actually give quality services to the patients.
Good. You see, you need to understand how the things you are using are acquired, isn't it? The forces behind them. What does it mean when they say there is drug shortage, so therefore the prices have gone up, isn't it? Or there are excess drugs, so the prices have gone down. A lot of you, I'm not training you for passing exam because you've already passed if you have been in my class. But I'm training you for the things that you need to remember when you are gone away from the university. When you will be running your own clinic or you'll be running a hospital. And we want you to be able to understand some of these things. Okay? So that, for example, on the demand side, it describes the degree of responsiveness of a person's demand for example, medical treatment. So if you describe, for example, the degree of responsiveness of a person's demand for, say, medical treatment to a change in his income, for example, so that you get income elasticity, isn't it? even in the services you produce. If you are running your own clinic, don't you need to know how the market behaves so that you can know when to raise prices and when to raise and when to lower them? If people around your vicinity where you are running your private clinic have been given a price, a salary raise, sio ndio saa ya kuanza kufikiria kama unaweza ongeza kidogo, kashilingi katano kidogo, right? So that is how you, and even at the national level, it's the same. Okay? So how people will demand the services you offer in relation to various changes in the market. For example, changes in their income. If they change in income, they may come more for treatment. I always give this example of ladies, and I hope they don't get annoyed with me. Yeah. Ordinarily, a lady can go for hair, inaitwa nini, hairdo ama inaitwa nini hiyo kitu, say for 500 bob. But when income increases, if her salary goes a little higher, will she go to the same 500 shilling salon?
No.
Yeah. The temptation will be to go to a higher one.
Yeah.
So that Mary can say to Angela, you see, mimi nimekuwa kwa saluni ya Mama Salome. Naye anajua mwenzake anaenda kwa Mama Agnes, which is cheaper. But that decision is informed, and you can describe that behavior, okay, by looking at the percentage change in income and what it will do to the services you are offering. I've used hairdo, but also your private clinics and so on. Are we together? All right. There could also be a change. There can be a change to the prices you are asking for. You see, that person will come to your clinic. If you increase the price, see, his demand for your medical treatment might also change, isn't it? Right? So that is the same, that is the importance of you understanding these concepts. Any queries so far?
Yes, a question.
Mm-hmm.
Can we say for supply, it's directly proportional to the price?
No, not necessarily. See, the supply is affected, not proportional. The supply is affected by price, at which producers are willing to make their products or their goods and services available. Yes? Are we together?
Yes.
Yeah. So you see, the producer or the supplier does not want to offer his goods and services unless the price can cover a number of things. Perhaps we forgot to say this. You see, we talked about, for example, the costs of production. Yeah? You will not supply goods and services whose production costs are higher than the price. So you must get a price that meets your cost of production. But that cost of production is also affected by the cost of producing substitute goods. Because again, if you are producing goods and services which can be substituted, then, and your costs of production cannot be accommodated by the prices you are charging, you'll go out of business. And I like using the concept of your clinics because that's what you will be. You will be running your clinics, isn't it? So if the cost of you producing a treatment, say for example, a vaccine session for a child, you see what goes into you being able to produce that vaccine and administer it on a child. Can we go together? What are the things that will cost, that you will cost, because now you will be the supplier? Yeah. What are some of the things you will consider, the costs?
Proper lab.
Yeah, you need a lab. That lab, see, it will cost you money.
Yes.
What else will you need? Oh, see, ni rahisi kwa nyinyi. What else do you need? See, you need a human being called a doctor or a nurse.
The personnel.
The personnel, sindio?
Mm.
What else will you need? What about equipment? Or you don't need equipment?
Yeah.
Yeah. Syringes, fridges, tables, desks, a space, a room, isn't it? All these will cost you. So you, in working out the cost at which you are willing to offer the vaccine to this child, you must cost all those things. And the price you will offer must cover all those costs, including your profit. Your profit is the cost of that skill, that professional skill that you are bringing in there. Okay? Are we together now? Have we seen why we need to understand these concepts?
Yes, we are together.
Because at every level, at the back of your mind, always remember that health economics is supposed to help your decision making as a health service provider or manager or consumer. Okay? So it will help you to make the decisions. Now, something very sweet. Let's talk about the market. Sio ni rahisi sana. Market. The market is where you will be operating, offering your services or consuming services. So a market is, as I have said, where demand and supply meet through the mechanism of price. Okay. And price signals consumer preferences and supplier willingness. And for a supplier, as we have said, he brings his goods and services to the market if it is profitable to do so. And the market is where now you allocate goods and services for consumption. And you allocate them through price. And the consumer in the market exercises what is called choice. And he exercises this choice, which we discussed last week, by vetting with his pocket. Okay? The consumer exercises choice. The supplier or producer exercises choice, whether or not to supply, or in the case of the consumer, whether or not to consume. These behaviors of these two opposites is moderated or mediated in the market. Okay. The market will give incentives or deny incentives. Okay. And for that reason, market is competitive. Market is competitive. So what are some of the characteristics then of a market? All right. We have a concept in economics which is idealistic. It is called the perfect competition market. It's the ideal. Become a binguni, you know? And this is what we use for doing the analysis. So what are the characteristics of a perfect competition market? What are some of the conditions? How is it viewed? In a perfect competition market, we have a large number of buyers and sellers, each small in relation to the total number, so that none of them are able to control the price or output. So you have a large number of people in this ideal market, large number of buyers and sellers, none of which can affect the price of the goods and services or the output. So we talked earlier about certain things called monopolies. In this type of a market, nobody is able to affect the markets significantly. Okay. So the second characteristic is that there are no barriers to entry. So producers are free to enter or leave the market. The consumers are free to leave or leave or enter the market. The production is mobile. It can, it does not affect anything. So here we are saying that no barriers to entry. You can enter as you wish and leave as you wish, but you are not big enough to affect the market. Then we say there are no significant economies of scale, which would give a price advantage to large-scale producers or large-scale consumers, and therefore provide a tendency to monopoly. We say that there are no significant economies of scale. Do we know what economies of scale are? Do we know what economies of scale are?
I could try.
Yeah, Yaribu.
Economies of scale is, for example, in production, if you are to get your raw material, you buy them in bulk, the prices you'll tend to get them at a lower price compared to buying them in small batches.
Excellent. Yeah, you see, the greater the quantity, the less the unit price. The unit price is the price per unit of the thing you are buying. So economies of scale are that if you produce in bulk, your cost of production per unit also, it gets lower. And if you produce very few things, your cost of production will go high. So when I was younger and I was a dreamer, I used to dream that the best thing I could have was a Mercedes. I don't know why I thought no other car could be as prestigious. But I used to wonder, why is this Mercedes thing, why is it so expensive? So a friend of mine told me that the producers of Mercedes produce very few of them. They produce few because they want a certain quality. Whether that is true or not, I have no idea. All right. Now, because they produce them in smaller quantities, their costs of production therefore are higher. So their prices must be higher, isn't it? Yeah. So because they are not benefiting from economies of scale. Whereas I was told Toyota, they produce en mass production. So they are cheaper because they have economies of scale. Have we understood? Are we together?
Yes.
Good, good, good. So we are saying that no significant economies of scale exist. So there's no benefit from economies of scale to the supplier, and there's no benefit to the economies of scale to the consumer. Otherwise, it would tend towards monopoly if that were not the case. So the fourth characteristic, there is no product differentiation or branding. Yeah, you know, you guys, you think that there is a difference between what are the various types of bread we have? The ones that they advertise in the radio. Moja inaitwa
super loaf.
Super loaf, ingine inaitwa
Broadway.
Broadway, ingine inaitwa nini? There are many, isn't it? They keep
United.
advertising. Huh? So that is called product differentiation. Some of it is wrapped in colorful wrapping paper. Some of it is given in less weight, 800 grams, 700 grams, like that. That is called product differentiation. So in this market, there is no product differentiation. There are no brand names, there are no something. So if you go to that market, you'll get a uniform thing called bread. Yeah. There is no difference between Broadway and Superloaf and kuna ingine huko Baringo sio wanaita nini? Yeah. Kuna ingine hapa Eldoret. So all of those are the same. So there is no brand naming. The producers are homogeneous. That is, they have no quality difference. One bread is bread. There's no difference. All right, and so that one is one of the characteristics. The fifth one, we have assumption of self-interest. Assumption of self-interest. So producers aim to maximize profits and consumers aim to maximize utility. Okay? So we are all selfish. The producer wants to maximize his profits. But the consumer also wants to maximize his utility. Yeah? Utility is the ability of goods and services to satisfy needs and wants. So the consumer wants to satisfy that utility or benefit. Yeah, so there is assumption of self-interest in all the players. The sixth one, is that there are no externalities or spillovers. So consumption and production are not affected by outside externalities, mean outside influences. So there are no externalities and spillover of effects to both production, in both production and consumption. Okay, so that an externality is created if people who are not involved in the decision to produce or consume are affected by it. So by that decision. So there are no externalities, there are no outside influences. The seventh one is there is no uncertainty. You have no advantage. Everybody has the same knowledge about the prices, about the goods, about everything. There is no uncertainty. So you cannot use uncertainty for your advantage. So there is perfect knowledge of prices and products and the implications for consuming or not consuming these products. So there is perfect knowledge. You have no ability to take advantage of uncertainty. Okay, so those are the 7 characteristics of a perfect competition market. And as I said, this is an ideal market, the idea of a perfect competition market. In reality, we have what we call market failures. Market failures. And these refer to situations in which these conditions necessary to achieve market efficient solutions are absent or are contravened in one way or another. So if anything affects any of those characteristics we have discussed, it results in a market failure. And anything that causes market failure is called a shock. So if you have shocks, the shocks interfere with the market. Okay. Now, any queries so far? Any queries? Good. So let's go to our last segment for today, so that next week we'll take you, and hopefully we finish health economics next week. I was thinking we will finish today, but maybe it was too heavy for you. Now, we have said that we consume certain goods and services because they will help us improve our health status. And this consumption of goods and services that help our status is called healthcare. So healthcare, we can call it a good or a service. So how do we differentiate healthcare from other goods or services? What is the difference, for example, between healthcare as a good and bread as a good? So we have a number of characteristics that make healthcare or health services different from these other goods and services, which we sometimes call supermarket goods and services. So these include first one is that healthcare has both consumption and an investment element. When people come to seek our services, they hope to improve their health status. And good health yields direct consumption benefit. If you are healthy, you also are able to participate in consumption and in production. Okay, when you are healthy, so you will contribute both to greater production and to greater consumption, and therefore greater investment. So what does this mean? For example, unhealthy people cannot produce, can they? In the case of doctors, for example, if doctors are sick, can they provide their services? Can they produce the services?
No.
But if they are healthy, they will produce the services, but they will also consume the same. They will also consume services, the same services. The second characteristic which differentiates healthcare from other supermarket type goods and services is that the cost of healthcare can be high in relation to income, so that ill health may also affect earning capacity. See, so the cost of providing healthcare could be higher than people's income. Ill health does not ask you whether you have a higher, whether you have enough money or not. It comes, isn't it? And sometimes it comes and you have very little income. But also, that ill health will affect your capacity to earn an income. So you can see it affects both ways. The other characteristic which differentiates is that patients have a direct involvement in the production as well as in the consumption of healthcare. Today you are a doctor, tomorrow you are a patient. All right? So patients have a direct involvement in the production of as well as in the consumption of healthcare. So hiyo dunia inakuwa namna hiyo. Today you are a doctor, you are the one offering the services. Tomorrow you are a patient, you are receiving the services. Are we together? Hello? Hello? No bad.
Yes, we are.
Yes, Doc, we're together.
Hello? Hello?
Hello.
Oh, imerudi. Hello?
Hello.
Imerudi.
Are you still on, eh?
Yeah.
Yes. Could you
Okay.
repeat the last point?
The last point before we disappeared, eh?
Yeah.
Tulisema,
Of course.
patients have a direct involvement in the production as well as in the consumption of healthcare. So as I was giving an example, today you are a doctor, you are the one offering the healthcare services. Tomorrow you are a patient receiving healthcare services. In other goods like bread, you are just a consumer. There is no time you will be bread. You just eat it. After that, you go to the toilet, and that is the end of the story. In health, you are today the one providing, tomorrow you are a patient. Okay? So that the fourth characteristic is that consumption or non-consumption decisions may actually be irreversible. Yeah? The choice whether to consume or not consume healthcare services or healthcare may be irreversible. And you know that sometimes people say, mi sitaenda hospitali. So what happens? Hello?
They can develop complications
Or you die.
or die.
Yeah. Or you get permanent disability just because of choosing whether or not to consume our services. Okay. So that is how we characterize, difference between the goods and services that we consume because we need them to improve our status or to maintain our health status, different from what we call supermarket type goods and services. Okay. How much more energy do you have?
0.
We are done. We are spent.
You're finished.
Yes, Dr.
Okay, so tell me, if I were able, I would have loved to finish this course at the latest by the first week of April. But to do that, it may be necessary for you to give me 1 extra day next week. Is it possible, or we just continue as we are and finish, do whatever we can manage?
Continue as we are.
No, we are winding up, but I'm asking if you can give an extra day, or I let you discuss among them yourselves and tell me. I would love if we could have an extra day so that we can try perhaps even finish next week. But if it is not possible, but you see, I think your time for exam is also coming nearer. So can you discuss and then let me know?
Yes, Dr.
Yeah, please discuss among yourselves and let me know by Friday. Good. Why don't we say we are very happy with ourselves and that not many of you went to sleep? Bye-bye till next week.
Bye-bye. Thank you for the class.
Good.